الثانية. رحب بكم جميعا مرة أخرى. معك دكتور فارس.
الو. يا دكتور سامعك كده الآن.
نكمل على بركة الله.
نكمل على بركة الله. طيب، ننتقل الآن إلى المحاضرة الثانية اللي هي عن الإنفلونزا والأمراض التنفسية في الخيول. تقدمها دكتورة إستر رولينسون. So, Esther, the floor is yours for the equine influenza and respiratory diseases. Thank you so much.
Thank you very much. All right, let me share my screen. So I hope you're all seeing my screen now and you can hear me all right. Thank you very much for the invitation to speak to you today. I hope you find this next hour really interesting. We're going to talk about the major causes of respiratory disease in the horse. I'm going to look at three areas. The first is just recognizing, does our horse have respiratory disease? And then we'll focus on the two biggest causes of respiratory disease in horses, which is one infectious cause, equine influenza, and one inflammatory cause, equine asthma. We'll talk about those conditions and what we can do to reduce the risk of horses developing these two conditions and how we manage them if they do get them. So let's start off thinking about respiratory disease. It's really obvious that obviously breathing is important, but having effective breathing really helps our horses to perform at their best. They need oxygen to their muscles so that they can perform at their peak. So respiratory disease is not just about keeping a horse healthy, it's also about helping it to achieve its best performance. If we look at the respiratory tract, the lungs in the horse are huge. They're a very specialized organ. The air comes in through the nose, down the windpipe or trachea, into the lungs, down very narrow airways and ending in little sacs called alveoli, which is where the oxygen exchange happens. If we were to lay out the horse's lungs, the surface area that the lungs would cover would be the equivalent of about 10 tennis courts. They're absolutely huge. When the horse starts to exercise, it starts to breathe in much larger quantities of air, up to 2,000 litres a minute, and can need more than 40 times more oxygen during exercise than it does at rest. So it's really important that these lungs are working absolutely at their best. Otherwise, we know we're going to start compromising the horse's performance. So if we think about what's normal in a normal horse, we're generally looking for a pulse around 28 to 44 beats a minute, respiratory rate of 10 to 14. Now, if we have a very fit horse, a race horse, for example, then the pulse rate and the respiratory rate can be lower. And if we have something like a small pony, these can be a little bit higher, and that can still be normal. But if we have a respiratory rate that's much faster than the 10 to 14 breaths a minute, then we're starting to immediately think that we may have a problem. And it should also, there should be no effort involved in breathing. When you're looking at a normal, healthy horse, it can sometimes be quite hard to see how fast they're breathing because they're not putting very much effort in. And something to be aware if we're going to look at a horse that might have a respiratory problem is to start by assessing the horse from a distance, because as soon as we go up and start physically touching the horse, they start becoming more tense and the way they breathe can change. So it's really good to look at the horse in the field or across the stable door and just watch how the horse is breathing when there's nobody close by, there's nothing happening to it. Other things we need to consider in a horse with a possible respiratory problem is what's the temperature. So is the temperature elevated or not? That could suggest we have an infectious problem if the temperature is high. And we're looking at the nose. Have we got any discharge from the nose? Is it clear or is it mucky? Is it white? Is it thick? And is what do the nostrils look like? as the horse widens its nostrils because it's trying to get more air in. And then the other thing we look at is the mucous membranes. So in the mouth, are these nice and pink? Are they moist? And does that all look normal? So these are the sort of things we'll be assessing in our horses if we think a horse may have a respiratory problem. So what signs might we be looking for if we have a horse with respiratory disease? Well, some signs can be very obvious. Coughing is what's most noticed by the owners, by the riders. You know, we can sometimes hear the horse cough when we walk into the stables. So most horses that have a respiratory problem will cough, but how often they cough and how badly they cough, how much they cough, that's going to vary depending on the underlying condition. So we're going to be asking questions around, when did the cough start? Was it very sudden, or has it been gradually getting worse? When does the horse cough? Is it after it's had some dry hay, or is it first thing in the morning when it's been in the stable overnight? How often is it coughing? Is it just very occasionally, or is it all the time? Is it a very dry, hacking cough, or does it sound moist? Does it sound like there's fluid in the airways? And does the horse cough anything up? It's sometimes worth looking on the floor, either in the stable or outside the stable, you know, where the horses stand with their head over the stable door. If they're coughing badly, sometimes you can see the phlegm that they're coughing up on the floor outside the stable. So other things we're looking for, are the nostrils flared because the horse is trying to get more air into its lungs? Has it got discharge? This horse has a very obvious pussy yellow discharge from its nose. You know, we shouldn't be seeing yellow or green discharge. Normal would be a very small amount of clear fluid, but anything that's white or yellow or green and thick is not normal. Have we got a raised temperature? And the other thing, for some types of respiratory infection conditions like strangles, we're feeling for the lymph glands which are underneath the jaw. Are they enlarged? This could suggest that we have an upper respiratory infection. So these signs are fairly obvious, but in many cases, the signs of respiratory disease can really be quite subtle, and it can just be things like poor performance. The horse that's maybe it coughs at the start of exercise. You know, the first time you trot, there's a little cough, and then that's it. So the horse that tires easily, that's maybe not running quite as fast as you think it should, that seems not as fit as you think it should be, maybe less enthusiastic in its work. When you're asking the horse to go a bit faster or to put in a bit more effort, the horse almost seems lazy and less fit than you think it should be. And the other things to look at are, how quickly is the horse recovering after exertion? Does it seem very tired? Is it just taking longer? You know, if you've been doing fast work and the horse is breathing very fast after that work, does it take longer than you expect to go back to normal? So some of these signs can really be quite subtle, and it can be sometimes very hard to differentiate, is this a horse that's just not very fit, or is this a horse that's got a respiratory problem? And particularly, you know, this sort of poor performance, sometimes it's also hard to distinguish between, is it respiratory, or has the horse got a physical lameness issue, for example. So key thing is to think about coughing. Now in humans, we can choose to cough. Sometimes we cough when we're nervous, we cough for all sorts of reasons. Horses it's thought they can't cough voluntarily. So when a horse coughs, it means usually there's something going on in the airway. Something has made that horse cough. So, you know, any cough should immediately get us thinking, what's happening here? I mean, obviously, if a horse inhales a fly, it's going to cough once, and that's the end of the problem. But any horse that we're hearing coughing, you know, intermittently, you know, more than once or twice, really should be checked out, because really any cough should be a cause for concern and can suggest that we have a respiratory problem going on. I'm hoping that this video on this next slide is going to work. Let's see if we can get that to run. So this is a horse that has really very severe respiratory disease. And what we're looking at here is the amount of effort that the horse is putting on it with its abdomen to help push the air out of the lungs. This horse has asthma and is really struggling, particularly to breathe out. So the abdomen here is working very hard to try to push the air out of the lungs. And although it's a bit of a hairy pony, you can almost see there's a line in the muscle here, because these muscles in the abdomen have become bigger because they're having to work so hard. This horse is really struggling to breathe, and this is a medical emergency and really needs the vet to be involved. But this, to an owner, this is not always obvious. I've been at a competition and one of my friends said, "Oh, my horse, he's not in the mood today, look at him." And she pulled his rug back and he was breathing like this. He had really bad asthma and she had no idea that his breathing was not normal. So what things can cause respiratory disease in horses? And we can think about three main categories. We have the infectious diseases. So equine influenza is the most prevalent, the one that's most important and that we're going to talk about in a minute. We also have equine herpes virus, which can cause respiratory disease as well as other syndromes. Strangles in the UK and some of the pony populations, we see strangles quite a lot, which is a bacterial infection of mostly causes a problem in the upper airways. Then we have the inflammatory diseases, and asthma is the main one. You've probably heard it called other names, Heaves, RAO, IAD. There were lots of different names for this condition, but we now call it asthma because it's very much the same as asthma in people, and it's much easier to understand if we use the same terminology. And then we have a few other conditions, infections in the sinuses or dental disease, which can then also spread to the sinuses. These can also cause sort of respiratory signs, because we can have discharge coming down the nose or discharge even going into the airways and making the horse cough. So some of these, although they're not respiratory conditions, they can look like respiratory conditions. So these are the main conditions that we're thinking about when we have a horse that we suspect has a respiratory problem. And so now we're going to look at equine influenza, and then afterwards we'll look at equine asthma. So why are we worried about equine influenza? Well, if we have an outbreak, as we actually had a big outbreak in the UK in 2019, this can have a really big impact. It's not just the effect on that horse that is ill with the flu, and that impact can be very big. It can be a fatal disease, and even if it's not a fatal disease, horses can be very unwell with it and ill for quite a long time. But it's the fact it's a very infectious disease, and therefore if we have a flu outbreak, it then impacts all the other horses, because firstly it can spread to the other horses on the yard, or at competitions it can spread to other horses. So often when there is an outbreak, competitions get shut down, yards get shut down, horse movements stop. If this happens in the breeding season, then we have, how do we get the mares to the stud to have their foals and to get them in foal again? If we're on a stud farm, potentially we can't move horses off the stud farm, and then we can have overcrowding problems because we can't shift the young stock that we were planning to move. So competitions can get very disrupted, teaching and training can get disrupted. So there's a financial impact, and there's an emotional impact on the horses and riders as well, because obviously they're now seeing their pride and joy, their horses really not very well. So it is very important that we try and prevent flu from happening, and if we do suspect flu, that we react quickly to try and stop it spreading elsewhere. So how do we find the cause of our respiratory disease? Well, if we're suspecting flu, a couple of things we can do. We might take swabs from the airways and look for the virus. We have quite a good screening program set in the UK, where one laboratory was looking at all the swabs, so that if there was an outbreak, it was being picked up quite quickly. For some diseases, we might have to do blood tests as well. For example, with strangles, we can do blood tests to see if a horse is carrying it, so that can help when we're having to move horses between yards. We can see if a horse has been exposed or not. So sometimes it's fairly obvious that we think we're dealing with an infectious disease because maybe a new horse came to the yard and then that horse started having a mucky nose and coughing, and then the horse next to it started, and then the horse next to that. Then we can be pretty sure we have an infectious problem. But it's not always as easy as that to know exactly what's going on. And certainly sometimes we need to do some further testing. So how do horses get infected with these respiratory infections, and in particular with flu? Well, with these respiratory infections, when the horse coughs, the droplets contain lots of virus, and these are transmitted in the air. So if there's another horse not that far away, those droplets can transmit from one horse to the other. There was some work done a few years ago when they looked at how far can these respiratory viruses travel. And in some reports, it was up to 2 kilometers. So that's a really long distance. So you can't just, keep the horses 100 meters apart and hope that the infection doesn't spread. Some of these viruses can spread a really long distance. Horse-to-horse contact is another one. Obviously, if they go nose to nose, you're passing the discharge from the infected horse's nose to the uninfected horse. So this is a very easy way to transmit the infection. But the other thing we need to think about is indirect transmission. And this is probably one of the biggest ways of transmitting flu and other viruses. If a horse drinks from a water trough, the infected horse is then passing virus into the water. The next horse comes along, also puts its nose into the water trough, and it can then get infected. The same with feed buckets, water buckets, anything that's moving between horses. People, when we go and we pat one horse and then we go and pat another horse, and we can take the infection with us. So these are all ways that the virus can spread. Herpes virus, for example, can last for up to 3 weeks in water. So the infected horse might have been there weeks ago. You bring your horse, drink from the same water, and your horse then gets infected. So indirect transmission is something we need to be really aware of. And there's a lot of things we can do in our behaviour to help minimise this risk of infection. So how can we prevent the spread of infectious respiratory disease? There's 2 key things we can do. One is vaccinating our horses, and the other is biosecurity. So I want to talk a bit about biosecurity, because that's something that is very easy for us to do. It's something that should be just a normal part of our routine when we're managing our horses, but it's so easy to forget sometimes. And biosecurity doesn't just help for respiratory disease, it helps for all different conditions. So we need to think about the different populations of horses on our premises. We have the horses that live on the premises and maybe don't go anywhere, but a lot of horses are leaving the premises for competitions and then coming back, or maybe they're going to stud and then coming back. So we have horses moving on and off the premises. We then have new arrivals that are coming from who knows where onto the premises. And we may have visiting horses. Maybe they're just coming for an hour's lesson, or maybe they're coming for 2 or 3 days and then going again. And these are all potential sources of infection. And any of these horses could bring infection with them and then infect the resident horses that are at the yard. So, and one of the other things to think about is if we have a large population of horses on a yard, maybe think about keeping them in different age groups, because the risk of respiratory disease is going to be different in different age groups. Young horses that haven't got lots of immunity yet, they may be at higher risk, so you maybe want to keep those separate from the horses that are going to the competitions, and likewise separate from the much older horses that again potentially have a higher risk, because the immune system tends to get weaker, if you like, as we get older. So what are some of the key things we can do for biosecurity? Well, first and foremost is making sure that all the horses on the yard are vaccinated, and that's not just the competition horses, that's everything. We'll come on to that again later. If we have horses that are going to competitions, then when they come back, it's trying to keep them away from the resident horses. So if you have, Some people may have some horses that only ever stay on the yard, and then others that go out to competitions. Try and keep them separate, so that, because the competition horses, the ones that are going away regularly, they are at much higher risk of picking up a respiratory infection. So it's trying not to have them in direct contact with the horses that are always staying at home and are therefore lower risk. Trying to avoid sharing equipment, so making sure that every horse has their own equipment, their own water bucket, their own feed bucket, their own grooming kit, and that it's not shared between horses, or if you do have to share it, then making sure it's properly disinfected. General hygiene is really important, and that's not just around the horse, that's the rider of the horse, it's all the yard staff that are doing the mucking out, the feeding and so on, but also people that are visiting, vets, farriers, physios, grooms. As vets, we're moving between yards, so we have to remember that there's a risk that we could pick up an infection at one premises and take it to the next one. So we have to be very careful about how we manage biosecurity ourselves as vets. The simple things like washing hands between horses and between yards, but also if we're moving between yards, maybe considering having different outer clothes, so a different set of overalls when we move from one yard to the other one. Making sure that high risk areas are very regularly disinfected, so water troughs, yard equipment, stables. If we have a new horse coming to a yard, making sure that stable is disinfected before the new horse goes in. When a horse leaves the yard, disinfecting the stable before you put another horse in there. If we have new arrivals, then these should be isolated, and ideally they should be isolated for 3 weeks, because this gives them enough time for that horse to develop the signs of an infection if it was already infected when it arrived. So 3 weeks is the ideal. Isolating them means ideally that they don't share the same airspace. So if you have like an American barn style, that ideally they're in a separate building. Now, obviously that's not always practical, but as much as possible, keeping them physically apart, apart in the stables, apart out in the paddocks, so ideally not the same airspace. And if you've got the same person having to deal with the new horse and the residents, doing the new horse last. So do all the feeding and the mucking out of the resident horses first, and then do the new arrival. And this means that you're less likely to take any infection from the new horse back to the resident animals. And then things like daily health checks, making sure that we're checking the temperature on any new arrivals, any horses that have been to competitions, checking the temperatures, because the temperature going up could be an early sign that horse is starting to come down with an infection. And then when we're at events, at competitions, what can we do there in the way of biosecurity? Again, we've talked about vaccinations, really important that we keep our vaccinations up to date, and especially if we're going out to competitions, or this applies equally to training. I go to a lot of events that are 2- and 3-day events, and a lot of people let their horses graze on communal areas. The problem with that is, one horse grazes there. If that horse is infected, then that area of grass is contaminated, and the next horse comes along, also grazes, can pick up the infection, and these viruses can hang around for a long time, for weeks. So it's really not a good idea to let the horse graze in communal areas. The same with communal water sources, and something simple is not putting the hose down into the bucket when you're filling the bucket, because the end of if someone else has done that, the end of the hose could be contaminated with virus. So always holding the hose above the bucket so that it's only water from inside the hose that's going into the bucket, and you're not contaminating it. Taking all your own equipment, your own water buckets, feed buckets, general equipment, really trying not to share. And if you do have to share anything, disinfect. You can go as far as having hand gel outside stables and a disinfectant foot dip outside the stables. It depends on what type of event you're at and how high the risk is there. And definitely avoiding horse-to-horse contact. It's lovely to see the horses touching noses and having a little chat, but that is a really high risk of transmitting disease between them. hopefully if you're in temporary stablings at an event, that the stables are cleaned and disinfected between horses and that there's fresh bedding for each horse. I know that doesn't always happen, certainly here in the UK, that's not always the case. And that means there is a risk of infection, again, going from one horse to another. And if you have any horse that looks in any way unwell, then of course isolating it and getting the vet involved straight away to see what's going on. Then when we come back from a competition or an event, again, thinking about that horse, although it's a horse that lives on that stables, in that premises, because it's been off-site, it's now much higher risk. So keeping it separate from the resident horses, disinfecting all the equipment that's been away at the competition, things that can't be disinfected like clothing, they could go through a hot wash, sort of 60-degree wash, again to kill off any virus, and just keeping a really close eye on the horse that's been away. So temperature checks are really useful, daily temperature checks, because that can give you an early warning that maybe there's something going on and this horse maybe has picked something up. So I've talked quite a bit about vaccination. So why is vaccination important? What are we trying to do with vaccination? Well, we're trying to do almost two things. We're trying to protect the individual horse that we vaccinated from becoming seriously ill. We're also trying to stop an infected horse from shedding virus and infecting other horses. So we have almost an individual effect that we're trying to get, which is keeping that individual horse healthy, but we also have a population effect that we want to reduce the circulation of the infection through the whole population. And this is why the governing bodies like the FEI and the racing authorities insist on vaccination for horses that are competing, because they're looking at the population level and they don't want their populations of horses to have flu circulating, because flu going into a racehorse population can have a really serious effect. We saw this in 2019 in the UK when we had to shut racing for 7 days, which cost millions, just a few days of not racing. So the population level is just as important as at the individual level. But as a horse owner, I don't want my horse to become sick. So I'm thinking about the individual. Organisations like the FEI are thinking about the population. Now, a horse that's thoroughly and well vaccinated can still get exposed to flu virus, can therefore still get infected with flu. But by vaccinating, our expectation is to reduce the severity of the disease and also reduce the amount of virus that horse produces. Something we have to bear in mind is that when we vaccinate, it takes time for antibodies to form. So the primary vaccination course for flu requires the 2 vaccinations given at 4 to 6 weeks apart, and the horse doesn't have really good levels of protection until 2 weeks after this. So if we have an outbreak, it can be quite hard if we have unvaccinated horses, it can be quite hard to get them vaccinated in time to sort of stop the outbreak. And what do we expect from the flu vaccine? Well, one way that we can assess the effect of the vaccine is look at the antibody levels that the horse produces in response to that vaccine. And we use something called the single radial hemolysis test, the SRH test, which tells us how many antibodies that horse has produced in response to the vaccine. So if we look at flu vaccine, and this is just a sort of a schematic of the sort of the typical antibody response we would expect. So with flu vaccines, we have a first vaccine and then the second vaccine, and the horse does produce some antibodies after the first vaccination. But when they have that second vaccination 4 to 6 weeks later, they produce really a very good immune response. And so 2 weeks after the second vaccination, we would expect the horse to be quite well protected. But that immune response does again reduce over time. And this is why we need a third vaccination about 5 months later. And this then gives us even higher antibody levels. And these tend to then stay for longer. And at this point, then we start going into the annual vaccination phase. So, we know the antibody does drop, we give an annual vaccination, and then it goes back up again. So depending on how much antibody the horse has is going to give us an idea of what level of protection this horse has. If we have very high antibody levels, then we would expect the horse to to not become unwell if it gets infected, and also to not produce any virus. Whereas if we have very little protection, then we expect that horse will be shedding virus and probably would become quite ill with the disease. So we're aiming for horses to have an antibody level over about 150, and this gives what is called sterilizing immunity, which means that the horse stays healthy if it gets infected, but also doesn't shed virus that could potentially infect other horses. Now, in reality, it's quite difficult to completely stop virus shedding. And as you can see, we have, because of the sort of timescales, we do have these times when the horse is still at risk. So, for example, after the second vaccination and before the third vaccination, the immunity will drop down. So these horses potentially are a little bit at risk until they have that third vaccination, and then their levels tend to stay higher. So conversely, if we have horses with very low antibody levels, these are the horses that have very little protection and could become, very ill if they do get exposed to influenza. There's two sort of caveats to this. So this is the response, antibody response we expect from a typical horse, but there are two things that can affect that. So an individual horse can respond differently. We have horses that might have some underlying infection we're not aware of at the time of vaccination. They might have a compromised immune system. For example, a horse with PPID or Cushing's disease doesn't have a very good immune system. It might not respond as well to the vaccination as it ought to. Very young animals, very old animals, the immune system just doesn't work so well. So we're always going to have individual variation in how good an antibody response the horse produces to a vaccine. But also these levels, they only apply when the vaccine strain matches the strain that's actually circulating in the field. Problem with equine influenza, exactly the same as with human flu, it's a virus that likes to change and mutate. Just like coronavirus that's going around at the moment, mutations happen. And if the virus that's circulating in the field is the same as the vaccine, then you're going to get very good protection. But if your virus that's circulating in the field is different from your vaccine, depending how different it is, you need a lot more antibodies in order to get the same level of protection. So this is something that's monitored all the time because the virus constantly evolves. There is the World Organization for Animal Health, the OIE. They have laboratories all around the world, and they monitor the equine influenza virus strains that are circulating and causing disease. And they meet once a year, the surveillance panel, and they look at all the data from all around the world and make a recommendation of which strains of influenza virus should be in the vaccines. And you can see on the map on the left here, this just shows from a few years ago how two different strains, clade 1 and clade 2, spread all around the world because horses are moving around the world. They're going for competitions, they're going for breeding, they're going for pleasure. They are moving all around the world. So you can see that, the clade 1 that was primarily a US strain then came to Europe, came to East Asia, came to Australia, and that's through horse movements. If you look on the bottom right, we have the sort of the family tree, if you like, of the current influenza viruses. So the two strains that are currently the main ones that are circulating are this Florida clade 1 and Florida clade 2. And the current recommendations from the OIE is that influenza vaccines should contain these two strains. That's the recommendation. Now, Boehringer's flu vaccine does contain these two strains. The technology we have in our vaccine allows us to relatively easily update the vaccine. So it was updated a few years ago when the OIE recommendations changed, so it has the most current recommended strains in it. That's not the same for all of the flu vaccines that are out there. Some of them have different strains in them. Something else we need to think about is what I called Vaccinating the Unvaccinated. It's very easy to forget about certain horses in our population. You know, on a premises, we might have 3 horses, we might have 300 horses. And the horses that are being ridden every day, that are going out competing, you know, those horses tend to get vaccinated. But sometimes we forget about the youngsters that are out in the field. You know, they're a year old, we're not going to do anything really with them for a couple of years, so they just stay out in the field and they can get forgotten. We have the old retired pony, you know, the kids' pony, it's still out there in the field, it poodles around, it's not going anywhere, we forget to vaccinate it. The pony that's the companion for the competition horse, again, it's not being ridden, we forget about it. It's really important to vaccinate all the horses in the premises, because often these ones that can get forgotten are the ones that are at highest risk of having a poorer immune system. So if one of the competition horses, for example, brings flu virus home with it, these are the horses that are most likely to get infected and to nicely spread it all around the yard. So it's really important that we vaccinate all the horses on the stable, in the stables, in the premises, on the yard, whether or not they're going out and competing, or whether they always stay on the yard. So that's really important. So just as a sort of summary, if we think about we had this big outbreak, as I've mentioned already, in the UK in 2019. We had in 2018, we only had 2 positive cases of equine influenza diagnosed in the UK. And then we had this outbreak at the beginning of 2019 where we had over 200 premises, so a lot more than 200 horses affected. And you can see from the map that also spread across to Europe as well, because of course horses move around. It had a really big impact. We had horses that died. Racing had to be stopped for, I think it was 7 days that racing was stopped. Lots of other competitions were cancelled or had great restrictions put on them. So it had a really big economic impact and welfare impact on the horses that were affected. But when we look at what were the factors in those places that had outbreaks, what were the key things that caused those outbreaks on those yards? And it was unvaccinated horses, it was recent new arrivals, mixing of horses at equestrian events, large yards where some horses were vaccinated, some horses weren't vaccinated, you know, just not kept track of very well, and then the lack of biosecurity on and off the yard. So these are all things that we as vets and as owners can do. There's a lot we can do to massively reduce the risk of getting influenza coming onto our premises, having influenza spreading through our populations. So there's a lot that we can do, and I hope this little session on influenza has been helpful in terms of just giving you some ideas and some reminders. A lot of it is, you know, it's very obvious what we need to do, but sometimes we just forget about the obvious stuff. And a lot of this is very easy to do, but a really key thing is vaccination and biosecurity. So now I'm going to move on to equine asthma. So this is the probably the most common cause of respiratory disease. Asthma is an inflammatory condition. It's a relatively new term. So previously we talked about a condition called idiopathic airway disease, IAD, or recurrent airway obstruction, RAO, heaves, broken wind, dust allergy. These are all different terminologies for what is now comes under the blanket term of asthma. And what asthma is, it's exactly the same in horses as it is in people. It's an inflammation of the lower airways, these really narrow airways in the bottom of the lungs. They become inflamed, they become narrowed, and then it gets harder for the air to go in and out. And it's caused by exposure to airborne particles or allergens. If we leave asthma untreated, the lungs long-term get damaged, and eventually that's irreversible damage. So it's really important that if we have a horse with asthma, that we recognize it early, we treat it, we manage it, and we try and prevent progressive damage to these lungs. We get a whole spectrum of presentations from IAD can just cause relatively poor performance without a lot of obvious signs, through to the severe asthma, like the video of the pony I showed earlier, where the pony was really struggling to breathe. So the mild to moderate asthma tends to be the younger athletic horses, and it's in some studies up to 80% of race horses are affected. So really very common condition. At the other end, the severe equine asthma, in the UK, it's estimated that 14% of horses have asthma. So, that's a significant number of horses, and it's such a potentially serious disease. We definitely need to address it. So what is asthma? We have environmental allergens or irritants, and we have, if we're talking about severe equine asthma, we have a genetically susceptible individual. So if you have 5 horses or 10 horses in a stable, all exposed to the same environment, not all of those horses will get severe asthma, only the ones that are genetically susceptible. But this genetic susceptibility leads to lower airway inflammation, which does 2 things. The airways constrict, so they're narrower, it's harder to get the air in and out, and you also get increased mucus production. So there's mucus now also plugging the airways. So again, it's even harder for the air to go in and out. The result of this is that the horse is finding it difficult to breathe, and particularly finding it hard to breathe out. So they can cough, wheeze. You will get nasal discharge because this increased mucus is eventually going to come up the airway. Generally poor performance, and if they're very bad, they can be very dramatic in their difficulty breathing. So what are these environmental allergens and irritants that can trigger asthma? There's a whole range of things, and any dust can do it, because just the irritant effect on the airways. But some of the things to think about is the gases from the ammonia from the bedding if the horses aren't cleaned out very regularly. Dry, dusty hay is a really big one, and straw bedding. We have a lot of people in the UK use straw bedding, and both the hay and the straw can have molds on them, not visible, but the mold spores are microscopic, and they can be a really potent allergen for horses that are susceptible. So these are, big reasons why we see asthma. If it's hot and humid, that tends to increase the circulating dust as well. And then we have almost a separate population of horses, some horses that are definitely allergic to pollen. So just like, people, some people have allergies to certain grass pollen or tree pollen, and horses exactly the same. So within the UK, we tend to see asthma. Our peak is probably this time of year, because horses tend to be stabled more over the winter when it's colder and wetter. And so there's, they're enclosed in a barn. There's not good airflow. There's more ammonia from the bedding because they're in their stables for longer. We're feeding dry hay, potentially have them on straw. So this time of year is our sort of peak for asthma. And then we get a second peak in the summer when there's a lot of pollen, particularly rape pollen. Rape is one of our the crops that are grown a lot in some parts of the UK. That's quite a common allergen for some horses. In your country, you may have a very different pattern, but again, you may well find that you do have a seasonal effect, because it does very much depend on dust levels and on the exposure to certain allergens. So if we think about the mild to moderate asthma, so this is common in the younger horses, particularly the race horses. These horses are often obviously stable. They're not out, don't tend to be out in fields. They're often in the stables for a long time. And depending on the design of the stable, that can really affect the airflow through the stables. The sort of signs we'd expect to see is the occasional cough. They've maybe been coughing for a few weeks. They don't tend to be really badly coughing, but there's definitely some coughing going on. The horse will be just not performing to the level that is expected. Maybe it's not running as fast as you'd expect, or it's just doesn't seem to have the stamina. It's losing speed towards the end of a race, just not performing to the level that you would expect. They often look fairly normal when they're at rest. They don't have a lot of extra effort. These are caused basically by poor air hygiene. There's not a genetic component here. So they don't have this condition for life. If you get them into a clean air environment, the signs go away and basically the horses are likely to be back to normal. So although we need to treat these horses when they have a problem, their sort of long-term outlook is very good. As long as they're in a clean air space, then they should be sort of back to normal. Whereas if we look at severe asthma, these tend to be slightly older horses. Again, there's usually a history of exposure, depending on whether it's a horse that reacts to pollen or reacts to the mold. Usually this would be a horse, typically it's this time of year, it's been in the stable a lot and now it's coughing. There might be a familial history. If we know the breeding of the horse, we may know that it's, one of its parents had a problem as well. The signs obviously tend to vary depending on what the allergen exposure is, but they cough regularly, they cough frequently, they can have quite obvious exercise intolerance, and there can be, in a severe case, really quite a marked respiratory effort. You can really see the horse struggling to breathe. There's no cure for this, and so we have to manage these horses for the rest of their lives, and that's both managing their air hygiene, having them in as clean an airspace as we can, but also using treatment as and when it's required. With horses, we tend to treat them when they have flares and get the condition back under control. So here's another horse that has severe asthma. And again, if you watch her breathing, you can see on the abdomen how much effort she's putting in here, really trying to squeeze the air out of her lungs. We've got a bit of a heave line along the lower abdomen here as well. And you can see she's quite thin. That's potentially the asthma that's really making her quite unwell. So how are we going to diagnose our asthma cases? Sometimes it's very obvious based on the history and the clinical signs, and then the physical examination of the horse, we can be pretty sure that we're dealing with an asthma case. But sometimes we do have to go to airway endoscopy as well to see what's going on. So with our airway endoscopy, there's two things we can do. One is a tracheal wash and one is bronchoalveolar lavage. Tracheal wash traditionally is considered the easier technique to do, and it's good for bacteriology because we can get a sample from the airway without contaminating it with upper airway bacteria and so on. So if we want to do bacteriology, then a tracheal wash is good. But it's not very good for cytology because there's very poor correlation between what we see in cytology from a tracheal wash and what's actually going on in the lungs. So if we want to look at the cells, the cytology in the lungs, we want to do a bronchoalveolar lavage. There are some, you can get sort of specially designed tubes effectively for doing bronchoalveolar lavage, and it's a fairly straightforward technique. So I think it's not as difficult as people think it is, and it is much better for looking at the cells in the lungs. It's not good for bacteriology because you're contaminating with bacteria from the upper airways, but it's really good for seeing what's going on in the lungs themselves. And so depending on what you find in the bronchoalveolar lavage, you can see on the chart here, if we have severe equine asthma, we're looking for over 25% of the cells in the bronchoalveolar fluid to be neutrophils. And that's what we're looking for with a severe equine asthma. One thing just to be aware is this is a really good technique for diagnosing asthma, but it's not a good technique for monitoring response to treatment. So you could treat a horse, get a really good successful treatment, the horse is clinically really well, but the cells in the fluid won't necessarily change. So you don't use this to monitor treatment, but it's really useful for giving us the diagnosis. So if we're looking at, we have a case of severe equine asthma, how are we going to control it? Well, there's a three-step process that we follow. We need to treat the underlying airway inflammation. This is an inflammatory disease. We need to get rid of those inflammatory cells. So that's the number one focus, is to treat that underlying airway inflammation. Now, if the horse has severe clinical signs, the time it takes for the airway inflammation to be treated the horse may need some other treatment in the meantime, just to relieve the clinical signs and help it to breathe. You know, some of these horses are really struggling, so you may need to give some short-term treatment just to relieve the clinical signs. And then the most important thing we can do for the long-term management is to reduce the exposure to the inhaled allergens. And that's, again, that's something that the owner has to do, and it really helps if we can get the owner to understand what's causing the condition, what they can do to help reduce the exposure to the allergens. If they understand where the trigger factors are coming from, what the allergens are that are causing that horse's disease, then it's much easier for them to manage their horse successfully going forward. So in terms of treatment, we're looking at managing severe equine asthma. We're not looking at curing it. We control flares with medication, and we try to improve the air hygiene for our long-term control. So if we're looking at our medical treatment, number one is to treat the underlying inflammation, and that means using corticosteroids. Now, corticosteroids can be given orally, by injection, or actually now by inhaler. Boehringer has just launched a steroid inhaler for horses. So there's 3 ways we can get steroids into the horses, but it is really important that we use steroids. I know sometimes we're concerned, certainly the sort of asthmatic horses we see in the UK are often the fat ponies that also have laminitis, and traditionally we were concerned about using steroids, but we have to use steroids in these horses. And with the inhaled steroids now, the type of steroid that's in the inhaled product, we don't have to worry about this risk anymore. The other thing we may need to do in the short term is relieving clinical signs, so using bronchodilators to open up the airways, and if there's a lot of discharge, then potentially using a mucolytic to reduce that mucus production as well. Again, something just to be aware of, the commonly used bronchodilators, they do lose their efficacy over time. So where traditionally, certainly in the UK, there's a lot of vets that just put the horses on the bronchodilators and keep them on them long term. That's not a good thing to do, because they do become less effective over time. So it's much better to use the steroids to treat the inflammation as and when you need to, and try to improve the airway management, the environmental management. So that's something that is absolutely critical. We must always have good environmental management. That's the foundation of managing our asthma cases. So, looking at 2 examples here. On the right, we have a horse out at pasture. That's a really good place to put an asthmatic horse, because you've got lots and lots of fresh air. There's very little exposure to allergens when they're out in the field. The stables above, again, it's a really nice design. You can see that the horses can look out of the back, so they've probably got really good airflow going, in the windows at the back of the stables and out of the front, so that you've got a really good airflow through. Whereas the stable on the left, to my shame, that was my pony's stable. He was in a very unsuitable stable for a while. Very, very little airflow, and you can see there's no airflow because of all the spider cobwebs on the walls. So clearly, there's, if you've got good airflow, you're not going to have cobwebs. So this was a really poorly designed stable, very poor ventilation, and then you can see all the dust that's trapped in the cobwebs as well. So that's a really bad example of, well, it's a really good example of very bad environmental management. So if we're thinking about environmental management, I tend to think of it in 4 main areas. First is the forage. So dry hay is about the worst thing that we can feed our asthmatic horses. We should be soaking the hay for 30 minutes or steaming it to reduce the dust, and obviously using clean water every time, or using haylage. And it needs to be, really quite, you can shake the hay or the haylage, if it's dusty or not. It needs to be as dust-free as possible. The bedding should be dust-free, so definitely no straw. Straw is really bad for asthmatics. My husband is asthmatic. If he walks into a stable that has straw in it, it sets off his asthma. Straw is a really bad thing to use for asthmatics. So some sort of dust-free bedding, whether that's shavings based. Wood pellets probably not so good, because they can be quite dusty. The picture of my pony, that was the wood pellet bedding that created all that dust. But sort of shavings, chopped rape, and there's lots of different types of bedding you can use, paper, all sorts. The stables themselves, maximum ventilation, every door and window open. The horses aren't worried about getting cold, and obviously in your country it's not so much an issue, but here in the UK people worry about the horses getting cold, and they shut all the doors and the windows on the stables. Much better have all the doors and windows open and put an extra rug on the horse. And you may have the opposite problem with it being too hot. I don't know how your stables are designed, but really thinking about having as much airflow through the stables as possible. And if you can't have entrances open, then having fans to get lots of air movement through is a really good idea. Something to think about is not having the bedding and the forage stored in the same airspace as the stables. It's fine if the horse with asthma is being fed a really low dust haylage, but his neighbours in the stables on either side are being fed with a very dusty hay, and the hay is being put into the hay nets right outside the asthmatic horse's stable. It's going to be exposed to all those allergens. So these are all things to think about. And then trying to get the horse outside as much as possible, head down as much as possible. It helps drain all the secretions from the lungs, and just getting them out in the fresh air as much as possible. And although we've talked about asthmatic horses here, I mean, fundamentally all horses are going to benefit from having a cleaner airspace. It can be difficult. Again, in the UK, we have a lot of people on livery yards where everyone is looking after their own horse and has their own ideas and is doing it differently. It's really important to try to get the whole yard to do the same thing, because if the one asthmatic horse, that owner is doing everything perfectly, but everyone else is, waving hay nets of dusty hay outside the stables and sweeping outside while that horse is in its stable, all these things are going to aggravate the asthma. So that's been a little journey through respiratory health in horses. So I hope you've taken away some really useful information. So the key thing to keep the respiratory health of our horses as good as possible from a prevention point of view: vaccination to prevent flu, biosecurity to try and stop our horses from picking up any infectious diseases, and then environmental management to keep the airspace for our horses as healthy as possible from the air hygiene point of view, to really help them maximise and optimise their performance by having really healthy lungs. And then from a management point of view is making sure that our owners are aware of what the signs are of respiratory disease, so they recognise it, calling in the vet early, getting diagnosis done early, and getting effective treatment on board as soon as we can to try and minimise the risk of this horse developing any long-term and permanent damage to its lungs. So I hope you found that useful and interesting, and I shall pass back to the moderator. Thank you very much.
Thank you so much, Dr. Esther, for the very interesting presentation. There is a few questions in the question and answer box. I will let you take a look and thinking on them until the Arabic session finished.
Thank you very much.
طبعا حدثتنا الدكتورة استر برزنتيشن مشوقة جدا عن تشخيص الأمراض التنفسية وكذلك إنفلونزا الخيول وربو الخيول، وقد بدأت بتوضيح أهم وظائف الرئتين وهي توفير الأكسجين للجسم، مع العلم أن احتياج الخيول للأكسجين يتضاعف سبحان الله 40 مرة في حالة بذل المجهود كما في السباق أو التدريب الروتيني، وذلك قد يتطلب استنشاق 2000 لتر من الهواء بالدقيقة الواحدة في حالة السباق مثلا. سبحان الله، لا يمكن أن يصنع ذلك إلا الله سبحانه وتعالى. في الظروف الطبيعية تكون درجة حرارة الخيول من 36.5 إلى 38.5، ويكون التنفس من 10 إلى 14 مرة في الدقيقة، ويجب مراعاة أن عد التنفس يكون قبل الاقتراب من الخيول حتى لا تتأثر الخيل وتزيد أعداد التنفس تلقائيا. وكذلك النبض الطبيعي من 28 إلى 44 في الدقيقة. المفروض أنه لا يوجد أبدا أي إفرازات أنفية، وتكون لون الأغشية المخاطية وردية ورطبة. هناك علامات للأمراض التنفسية في الخيول، علامتين أوليتين، وهما ضعف الكفاءة في العموم والكحة خاصة قبل التمرين أو بذل الجهد. إلا أن هناك علامات أكثر وضوحا، تتطور العلامات إلى أكثر وضوحا، وهي الكحة الدائمة، وهي هامة جدا لتشخيص الأمراض التنفسية، وذلك لعدم قدرة الخيول في الطبيعي على أن هي تكح. فإذا الكحة علامة مميزة جدا لوجود مرض تنفسي. وكذلك عدم وجود شهية للأكل مع ارتفاع في درجة الحرارة قد يصل إلى الحمى، وكذلك وجود إفرازات أنفية بأي لون، أبيض أو أخضر أو أي لون، ده معناه أن فيه مرض تنفسي. زيادة معدل التنفس، كذلك صعوبة التنفس مع إحداث أصوات ضيق مجرى التنفس اللي هو الصفير أو الأزيز مع التنفس. طبعا هناك أسباب معدية للأمراض التنفسية، وهم أساسا ثلاثة. أولها وأشهرها هو إنفلونزا الخيول، ثم الهيربس، وثالث مرض وهو الخناق اللي هو الاسترانجلز. ومرض الخناق تسببه بكتيريا الميكروب السبحي غالبا في المهور وكذلك في الخيول الضعيفة عموما. وما يميز هذا المرض هو استمرار إفراز الميكروب اللي هو البكتيريا الميكروب السبحي لمدة 6 أسابيع بعد توقف الأعراض. يصيب هذه البكتيريا تصيب الغدد الليمفاوية، وبخاصة في منطقة الفكين. كيفية انتقال العدوى: تنتقل العدوى عن طريق التلامس المباشر من حصان إلى آخر، وكذلك عن طريق التلامس الغير مباشر عن طريق مشاركة الأعلاف أو المياه أو الأدوات، ويمكن أن تنتقل العدوى عن طريق الهواء. وتكمن الحلول في شيئين فقط: التحصين ومراعاة الأمان الحيوي. الأمان الحيوي يتمثل في التأكد من تحصين كل الخيول، ثانيا عزل الخيول الجديدة ومن ثم التحصين قبل الالتحاق بباقي القطيع، والتأكد من عدم مشاركة الأدوات والمعدات، وكذلك التطهير الدوري المستمر، وأيضا الملاحظة الدقيقة للأعراض التنفسية لسرعة التدخل والعلاج. شروط التحصين الجيد أن يحتوي على كل العترات السائدة كما قالت دكتورة إستر، كليد 1 وكليد 2. يجب تحصين كل الخيول وما يصاحبهم، حتى الريتايرد هورسز، حتى المحالين إلى المعاش أو اللي ما بيشتغلوش أو اللي ما لهمش أي وظيفة. وقد لخصت دكتورة إستر أسباب وباء 2019 اللي هو إنفلونزا الخيول في 2019 إلى 3 أسباب رئيسية، وهي وجود خيول غير محصنة، ثانيا إضافة خيول جديدة دون عزل، ثالثا خلط الخيول في السباقات والمناسبات. يكون السبب الرئيسي في ظهور الوباء هو عدم استخدام التحصين. وقد عرجت الدكتورة إستر أيضا على ظاهرة الربو، وهي التهاب الرئتين المزمن، أي التهاب الرئتين لمدة طويلة، ويحدث في 20 ل 80% من المهور الصغيرة، ويكون متوسط أو بسيط الشدة، إلى أنه قد يكون قاسي جدا في 14% من الخيول الكبيرة. لا يمكن الشفاء الكامل أو التام من الربو، ولكن يمكن السيطرة عليه وتحجيمه عن طريق العلاج. والعلاج يتمثل في استخدام الكورتيزونات وموسعات الشعب، وكذلك الأدوية التي تقلل إفرازات الجهاز التنفسي. والأهم من ذلك كله، الأهم من العلاج حتى، هو تقليل تعرض الخيول لمسببات الحساسية من أتربة وغبار، وكذلك الأعلاف وما يرتبط بها من عفن، وبخاصة الدريس، وكذلك حبوب اللقاح، وأهم شيء زيادة نسبة الأمونيا في الاسطبلات. ده عامل مهيج للجهاز التنفسي ويسبب إصابات بالغة. للحفاظ على صحة الجهاز التنفسي في الخيول، أوصت دكتورة إستر بإجراءات منع العدوى، وهي استخدام التطعيم لكل الخيول، ومراعاة الأمان الحيوي، وتهيئة بيئة نظيفة، وتهوية جيدة جدا للخيول. ونحط تحت تهوية جيدة جدا دي 100 خط، لأن التهوية الجيدة هي أساس السيطرة على أمراض التنفسية في الخيول. وأيضا هناك التعرف المبكر على الأعراض التنفسية وسرعة العلاج، تشخيص الصحيح للمرض، واختيار العلاج الناجز المؤثر. إلى أن أهم ما عرجت عليه الدكتورة إستر في الحقيقة هو برنامج التحصين المثالي للإنفلونزا، حيث نعطي الجرعة الأولى، ثم تلحقها جرعة ثانية بعد 4 إلى 6 أسابيع، ثم جرعة ثالثة بعد 4 إلى 6 شهور، وتكون الجرعة الرابعة سنويا. هذا البرنامج يفضي إلى مستوى مناعة مثالي، وما دون ذلك ينتج مناعة جزئية وغير كاملة. الميكروفون الآن مع الدكتور فارس لاستكمال جزء الأسئلة والإجابات.
Thank you, Dr. Nahrawi. Dr. Esther, let us go directly for the first question regarding is there any evidence or studies about if horses can get infected with COVID-19?
A very topical question. To my knowledge, there's been no evidence of horses becoming infected with COVID-19. There have been 1 or 2 case reports of dogs and cats that have tested positive, but it was in every case, my understanding is that they became infected from the household, so from the people. So the people infecting their own dogs and cats, and the animals didn't seem to be able to transmit it. But I'm not aware of any cases in horses. I mean, coronaviruses occur in all species, and horses have their own coronaviruses, but obviously not COVID-19. So to my knowledge, there's been no documented cases in horses. So yeah, I don't think there's been any.
Can I add comment here, Dr. Faris?
Yeah.
Yes, please.
Each group of animals, each family of animals had its coronavirus, and the coronavirus of equines has only enteric tropism, has no any respiratory tropism. Yeah. For example, in ruminant and in camels either, coronavirus can be enteric and respiratory, but luckily in horse, it is only enteric.
Thank you. Second question regarding benefits. Benefits for adding omega-3 fatty acids to the diet to resolve clinical signs of equine asthma.
That's a really interesting question, and there's been a lot of research done in people, in children in particular, looking at omega-3 fatty acids and asthma in children. You know, we've had such an increase in asthma rates in people, particularly in children, and one of the hypotheses is there is a dietary effect. I mean, the theory would be that omega-3 fatty acids, particularly EPA and DHA, they are one of the, if you like, building blocks for some of the anti-inflammatory molecules in the body. So feeding omega-3 fatty acids could have an anti-inflammatory type of effect. Or certainly we need the omega-3 fatty acids in order to be able to produce our own natural anti-inflammatory molecules. I don't think anyone's looked at it in horses, and certainly in people, they are seeing there are some trends that more omega-3 in the diet is correlating with lower asthma levels in children, but they don't know whether there's a direct cause and effect. So I think this is something that we don't really know. It certainly won't do any harm, but whether there's any major beneficial effect, that's very difficult to know. Generally, with these sort of dietary things, any benefit we see is relatively small compared to the effect we might see, from example, from treating with steroids if we have a horse that's having a flare. But if we're talking about a sort of preventative, you know, where we're trying to do everything we can for an individual horse, the most important thing is the air environment. Whether omega-3 fatty acids will help, I don't think anybody knows, but it's a really good question, because this is an active area of research in people at the moment. Yeah.
Thank you.
I also have comment here, Dr. Faris, if you let me. So, so the line of treatment for the asthma, depending upon using corticosteroids and to reduce a little bit the function of the immune system. Omega-3 may make the opposite in my mind. Omega-3 improves some immune functions and increase the lifespans of some immune cells. So it might be the opposite in the line of treatment of asthma.
Okay. Doctor, there is a question and comment from Saja. I would like to send a message to those who use non-medical masks for horses, especially before the horse race, and its harm to them.
Yeah, I mean, this is not something I've come across before, because we don't have this in the UK. But if you're putting a muzzle on the horse, you've got, from a biosecurity point of view, if you're sharing muzzles, using it on one horse and then another horse, then absolutely you're going to be spreading infection. And if you're putting a muzzle on, you're interfering, depending on the design of the muzzle, you're interfering with the airflow into the horse's nostrils, so that potentially you could have a lot of mold and dust and that sort of thing in the actual muzzle itself, and you're just going to interfere with the horse's ability to get the maximum amount of oxygen into the lungs. So it will depend on the design of the muzzle and whether you're sharing between horses, but certainly it's not something I have much expertise on, because we don't do this in the UK. But yeah, it's a really good point. Anything that we're sharing between horses is a really high risk for spreading infection. Okay.
Another question, can I use nebulizer in application of bronchodilator drugs in treatment of asthma?
Yeah, this comes up a lot. So there are, the problem with nebulizers is that they're not calibrated for the medication that we're putting in. They're not designed to be used with specific medications. So you have a lot of potential variability in the actual dose of the drug that the horse gets. I know the nebulizers are designed for horses. They're designed to fit to horses, but they're not medical. They're not licensed medical devices. With the Boehringer inhaler, it's absolutely calibrated. We had to prove that the exact dose that we say it gives is actually what the horse is giving. When you're using nebulizers, and people use all different medications in the nebulizers, often they're using injectable medication, and that injectable medication is not designed to be inhaled. I mean, we make an injectable that sometimes people ask about putting in a nebulizer, and the answer is please don't do it. A lot of people use steroid injections into nebulizers, and with reasonable success, but you've got very unpredictable doses that the horse gets. And there's a perception that if they inhale it, that it has no systemic effect, so it's safer in a horse with let's say, a risk of laminitis. But the reality is that it does go systemic. It has just as much systemic effect as if you were to inject it. So a lot of people use nebulizers, and partly that has been because there has been no other alternative. But there are some limitations to nebulizers. The other thing with nebulizers is often in yards, they share them between horses. And as soon as you share between horses, you are spreading infections between horses. So this is the other thing to be really careful with.
Thank you. Is there any sanctions for vaccination irregularities? And other question, when horses can compete after flu vaccination?
Yeah, I think the sanctions vary by by the different regulatory authorities. So that's going to depend on which rules you're competing under. The other question was, what was the other one again?
When the horse can compete, yes.
So there's two different things to consider here. One is, again, from a regulatory point of view, some of the governing bodies have rules that say you cannot compete within 7 days of vaccination, for example, and these rules vary depending on which governing body, so you need to check for the exact competition. But the other thing is thinking about the horse. You know, when we're vaccinating, we are asking the immune system to respond. We want it to do something, and that's why a lot of horses, just like us when we have vaccinations, feel not quite 100% a day or two afterwards, because our immune system, when we have a vaccination, is actively working. So we don't feel absolutely at our best. So I would say it's not sensible to work a horse really hard a few days after vaccination, because the horse might not be able to perform quite at its best, because it might be feeling a little bit not 100%. So those are the two things to consider. You know, adverse events to vaccination, like with any medication, can happen. So, you know, with my own horses, I don't vaccinate them a week before a really important competition, just in case there's an adverse event. But yeah, from a competition point of view, the two things to consider is what is allowed by the regulatory authority for that sport, and just not sensible to work a horse really hard immediately before, immediately after vaccination.
Thank you. Last question, if I read it right, what about bastard form of strangles or atypical form?
Yeah, this isn't something, I'm afraid, that I know an awful lot about. You know, all of the strangles cases that I've treated in my days in practice were generally the fairly straightforward, you know, young horse strangles. In bastard strangles is it's a really difficult condition. I know there's discussions whether we should or should not treat with antibiotics. I'm afraid it's not an area that I know a lot about. I don't know what the current recommendations are for treatment. So apologies, I can't answer that question very well, and I don't want to guess and give you a wrong answer.
Thank you so much for the very useful presentation and answering the questions. I don't know if we have another one. No.
Just seeing that, just a comment from Hoyt, that there is one abstract on omega-3 in horses with some evidence of benefit in asthma. So it's definitely an area where I think there's active work going on at the moment. There's a logical reason why omega-3s might be beneficial in any inflammatory disease. You know, I used to work with skin disease in dogs, and we used a lot of omega-3 fatty acids because it's an inflammatory problem. So there's definitely some rationale for considering omega-3s in asthma as well, but there's just not really enough evidence yet to know how much and what to give.
Thank you. With this from my side, I would like to thank you so much, Dr. Esther and Dr. Hoyt, for the very useful presentations. Also, I would like to extend my sincere thanks to Dr. Mohammed Burham, the head of veterinary sector in our partner in Saudi Arabia, Desert Hills Veterinary. And with that, I would like to give the floor to Dr. Ali Dweirij for final comments, closing, and summary remarks. Thank you, Dr. Ali.
السلام عليكم ورحمة الله وبركاته. أسعد الله مساءكم بكل خير. أول شيء, I would like to thanks to Dr. Esther and Dr. I'm sorry,
Hoyt, yes.
Yes, for a valuable presentation, and thanks for all. أشكركم جميعا، وأيضا أشكرك الدكتور فارس والزميل اللي ترجم معك البرزنتيشن. حقيقة أنا استفدت كثير من هذا البرزنتيشن، وأتمنى إن شاء الله بإذن الله الأخوة والأخوات الحضور استفادوا من هذه العروض القيمة، وأعتقد على حد علمي أنها من الفعاليات القليلة الموجهة لصحة الخيل في المنطقة العربية في الفترة الأخيرة. طبعا كثير من الإجراءات وكذا زي ما تطرقوا لها السادة الخبراء، أنه أحيانا إجراءات الأمن الحيوي راح يعني بإذن الله تساعدنا كثير على تجنب الكثير من المشاكل اللي ممكن توجه للخيل، وخاصة فيما يتعلق بالأمراض التنفسية والأمراض الطفيلية. البايوسكيورتي يعني مفتاح أساسي للوقاية من الأمراض وتقليل مخاطر الأمراض بشكل عام. احنا نحرص تماما في وزارة البيئة والمياه والزراعة على يعني نشر مفاهيم اللي هو أو تعزيز مفاهيم الأمن الحيوي لحماية الثروة الحيوانية من الأمراض، وأيضا بطبيعة الحال حماية الإنسان ومن مخاطر تلك الأمراض، عملا من مبدأ اللي هو الون هيلث أو الصحة الواحدة، اللي احنا ما نقدر نفرق اللي هو صحة الحيوان عن صحة الإنسان عن صحة البيئة بشكل عام. العالم يمر بمتغيرات، التغير المناخي يفرض نفسه، التغيرات حتى الآن كوفيد من ضمن التحديات اللي تواجهنا بشكل عام في الصحة الحيوانية والبشرية على حد سواء. دائما يعني الوقاية خير من العلاج بشكل عام، ولكن يعني دائما نتمنى نعزز هذه وأن نستثمر استثماراتنا أكثر في الوقاية قبل أن نصل إلى يعني مرحلة العلاج. أخيرا أنا ما أحب أطيل عليكم، وكانت يعني فعلا يعني ورشة عمل قيمة. أشكر شركة يعني بوهرينجر على استضافة هذا الخبراء، وأتمنى يعني نقل شكرنا لهم والجميع مسؤولي الشركة سواء في المملكة العربية السعودية أو في مكاتب الشركة حول العالم. حقيقة كانت فعالية قيمة، ويعني تجسيد مبدأ الشراكة بين القطاعين العام والخاص لتعزيز الصحة الحيوانية وتحقيق الأهداف المشتركة للجميع. أشكر جميع من يعني انضم إلينا، أشكركم جميعا أيضا في الشركة، وأشكر أيضا السادة أو الخبراء اللي حضروا معنا. وأذكر الجميع أن هذه الحلقة موجودة على موقع الإرشاد البيطري الخاص بوزارة البيئة والمياه والزراعة على موقع اليوتيوب إرشاد فت SU، ممكن الرجوع لها في أي وقت يعني للاستفادة منها كمرجع عربي قيم في الأمراض التنفسية والأمراض الطفيلية والمواضيع الأخرى التي تهم مربي الخيل. كل الشكر والتقدير لكم دكتور فارس ولجميع زملائكم، ونلتقيكم دائما على خير
بمشيئة الله. يوم 10 إن شاء الله 10 مارس عندنا السكند ورك شوب إن شاء الله
بإذن الله. كل شكرنا لكم. تصبحون على خير.
شكرا. Thank you so much. Thank you Esther. Thanks Hoyt for joining us. It's our cordial thanks from all the attendees, from Dr. Ali and from all people in Saudi Arabia. Thank you so much.
وعدنا إن شاء الله 10 مارس.
إن شاء الله موعدنا 10 مارس إن شاء الله second workshop.
شكرا لك.
السلام عليكم.